He says he spent all this money on developing vaccine manufacturing capacity. Did he, his industry minister, his procurement minister, whoever, even bother to negotiate the rights for us to manufacture those vaccines here at home?
We have signed and secured vaccine delivery contracts for 2021 with tens of millions of doses. We know how important it is to deliver for them quickly. And in signing the contracts, yes, we looked at different ways of ensuring domestic production as much as we were able to. But that, unfortunately, is not something we can move forward on.
Prime Minister Justin Trudeau took some questions today in the House of Commons there. He reiterated Canada can't produce COVID-19 vaccines here at home, and that's partly why Canadians may get their vaccines later than citizens in other countries. Christopher Rutty is a medical public health historian. He joins us from Toronto. Hi, Professor. Good to see you. We wanted to get some more information about domestic capacity here when it comes to vaccines, so I appreciate you joining us to shed some light on it.
Okay. I'm an historian, so I'll come from that perspective.
Yes,
for the most part.
and we appreciate. So my basic question is: does Canada have the ability to A, manufacture domestically vaccines, B, COVID-19 vaccines?
Well, yes. To the first question, we have a major production facility in Toronto, the Sanofi Pasteur site, that has been producing vaccines for over 100 years on that same site. So the challenge is it's committed to a whole range of other vaccines, regular vaccines we use, pediatric vaccines, adult vaccines. It produces vaccines for Canadian use and exports a lot of vaccines globally. And there's also a site, GSK site in Quebec City that produces flu vaccine. So it's not like we don't have capacity. The problem is the capacity we do have is not Canadian owned, which sort of raises issues potentially. But it's committed to, as I said, ongoing commitments to other vaccines. So it's a very difficult challenge to sort of suddenly produce another vaccine on top of what you're already producing. In order to do that consistently and to meet regulatory demands, you can't just sort of slap up a warehouse or a building very quickly and have it meet all the requirements by the regulatory authorities here in Canada and elsewhere in terms of staff, and because a vaccine has to be consistently produced over time, has to meet a whole range of regulatory demands, and so it's not a simple issue. And we're not the only countries dealing with that. I mean, other countries have and don't necessarily have their own vaccine capacity domestically. They may have a production capacity for other vaccines, but not necessarily to suddenly make COVID vaccine. So we are relying on kind of the bigger firms that have a lot of production capacity, potentially, at least flexibility, and setting up a new platform for one of these new types of vaccines. Because we're dealing with the whole range of new vaccines. We're starting from scratch with COVID vaccines, right?
Yeah. I wanted to ask you about that because COVID vaccines are not, it's not the same thing as the flu vaccine. And even in the grouping of vaccines themselves, what I've heard so far and learned so far is it even within the range of ones that so far are showing, let's say, promising results, they're different types of vaccines. They require different things.
They are not licensed. No coronavirus vaccine has been licensed at all yet. And to prove, we've done very well, very fast with the various candidates that we're talking about at the moment, but there's more lining up behind them. And so we're just happen to have the first three that are coming through that are from Pfizer and Moderna and AstraZeneca, and hopefully they'll be great. But they have varying capacities, varying properties. Pfizer requiring a very deep cold chain to keep it good, so that requires issues. So we're dealing with a whole new world in many ways with this. It's not like a flu vaccine for a pandemic flu is based on an existing technology we've had for many, many years. Mm-hmm. It's well experienced with it. It's well regulated and licensed. There may be variations in it when we have a pandemic, but essentially the same type of vaccine. But with coronavirus, we're dealing with multiple types of vaccines from various producers around the world, and trying to do this in the context of a pandemic. We just listened to Bonnie Henry there. Just what's going on in real time here and globally, it creates a whole different kind of situation to try to meet that demand. And we haven't really had to do that before on this scale. Yeah. And so it's sort of unfair to kind of criticize our own particular situation here in Canada and sort of an inability to respond as quickly as we could. When we have an historic legacy of being able to do that in the past to much good success. Connaught Labs in its heyday did a lot of that with polio vaccine in a very similar situation in the early 50s. So it's not like we can't do it, and maybe out of this process we'll create something new, maybe something new model with Vito in Saskatchewan, or
Right.
another kind of situation to create a new facility somewhere. That would be great. I mean, hopefully we will.
Let me ask you a question about the way in which that comes about. So obviously we have those 2 facilities there's money that's been invested there, and that's for the future. We've actually spoken to Dr. Gertz, who runs the one in Saskatoon, and he's talked about his timeline. It's very clear. It takes a while to get it first up and going, and then second scale up production there. It's not something that happens.
Exactly.
It's not something that happens overnight. From your perspective, and I know it's difficult to assess probably because we have not been in this situation before, but the insinuation is that we might be at a disadvantage because we can't domestically manufacture these. From your perspective, is that a disadvantage when it comes to being able to roll out the vaccine as far as a timeline goes?
Well, I mean, in some ways, you can say that. I mean, it's sort of a Canadian reflex, I suppose. I mean, we've been able to do it before, but the past situations were very different. We are part of a global kind of organization. I forget the name of it. And we are partnering with a whole global arrangement with other countries to support a global arrangement to provide vaccines. Because, again, we're not the only country in this situation. Most countries are in the same situation. They don't have a big production company working in their country to make vaccines, so they're going to do the same thing. And so, I mean, it's a bit, I don't know, a bit misleading, I suppose, to sort of focus on that particular situation we're in right now. We are well served. We have bought into a whole range of vaccine options. And so, I mean, I don't think we're going to be, maybe it's a bit of a lineup, perhaps, but I'm not sure we could have really avoided that. Even if we had, I mean, the Sanofi site in Toronto could have, I mean, it's partnering with GSK to make a vaccine. It's a little further down the line, but unfortunately, part of that's not being made in Toronto. It could have been. I mean, I'm not up on that myself personally, but it's not necessarily a fault of the Toronto site. It's committed to a lot of other things. It's producing vaccines for globally on a large scale. So it's not a fault of it. It's just the whole situation of trying to suddenly make a new vaccine, new technology, and do that all properly, quickly is a very, very difficult thing to do. Right?
Yeah, it's complicated. Okay, I'll leave it there. Thank you, Professor Rutty.
Not really. Okay.
Or not. It seems complicated to me.
It's an interesting story. It's to be kind of rewatching historically too. So
I bet.
One of many aspects of all this situation. So.
I bet. Have you ever seen attention like this paid to a vaccine? I mean, just the speed at which it's all happened.
Well, it's very much like polio. That's my special area of expertise in the 50s. We and Connaught Labs in Canada was in the forefront then, very much so. We wouldn't have had a vaccine without it. And so and that's sort of part of the problem today. Looking back, we've had that before. We've done different things, and not to be able to do it now is I guess frustrating politically, and so it's just sort of the way it goes. I guess it's a difficult situation all around, and we're not the only ones. So it's not just us. There are other people, like France. I mean, other countries could say the same thing, really.
Well, thank you very much for making time for us this evening, Professor. It's great to have you with us.
You're welcome. Take care.
Professor Christopher Rutty joined us from Toronto. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.